postgraduate Ayurveda course at Alma Mater Europea. I greet today the representatives also from International Maharishi Ayurveda Foundation. Dr. Rainer Picha, Sylvia Hawkins is also with us. On the behalf of Alma Mater Europea, I warmly say welcome to Ayurveda course at Alma Mater Europea. Today, the presentation of the course will be held by Dr. Gordana Marković, the head principal of the course. She is assistant professor at Alma Mater Europea. The other professors who will conduct this course will be Professor Emeritus, Professor Renade, then Dr. Wolfgang Schachinger, and other Vaidyas from India. Let me say a few words about Dr. Gordana Marković. She has like 20 years of medical practice and a specialist of social medicine and public health. She is also a member of State Expert Committee on Complementary Medicine in Serbia as a part of Ministry of Health. Dr. Marković studied Ayurvedic medicine in Netherlands, Switzerland, Serbia, and India. And like I said, she is a postgraduate certificate in Ayurveda at Alma Mater Europea, University Maribor, Slovenia. Dr. Gordana Marković will present now the course like in half an hour. After that, we will have questions and answers. Dr. Marković, please, stage is yours.
Dear all, I would like to welcome you to this webinar, in which I will present to you the first postgraduate training in Maharishi Ayurveda for the medical professionals at the Alma Mater Europea University. In the next half an hour, I will introduce you to the benefits of studying Maharishi Ayurveda and applying it not only in your practice, but in your personal life as well. I will walk you through the structure of the course, the key topics of the training, and explain the essential elements of Ayurvedic medical treatment process. The basic principles, pulse diagnosis, protocols for common diseases, herbal treatment and aromatherapy, and tissues and channels. After my presentation, if you have any questions regarding the course, my colleagues and I will be glad to answer them. Looking for a more wholesome approach to preserving good health and treating illness, a growing number of patients and healthcare professionals worldwide are showing interest in the application of integrative medicine methods. According to the World Health Organization, over 100 million Europeans currently use at least one of these methods. It is very important that physicians and other healthcare providers incorporate this integrative practice that is evidence-based. Because of that, it is my great pleasure to introduce you to the postgraduate training in Maharishi Ayurveda for health professionals, which will present an extensive and very effective approach to integrative medicine. This one-year-long training was created by the experts of the International Maharishi Ayurveda Foundation and will be held at Alma Mater Europea University in Maribor in Slovenia from the 13th of April 2021 to the 10th of April 2022. Maharishi Ayurveda is a comprehensive, practical, and time-tested modern formulation of the world-oldest system of natural healthcare, prevention-oriented, free from negative side effects, and consciousness-based. What is important to highlight is that this is all evidence-based medicine, and the results of many studies show on the effectiveness of Maharishi Ayurveda has been published in peer-reviewed medical papers. There is also a Maharishi Ayurveda a summary of research findings, which is available on the International Maharishi Ayurveda Foundation website, where you can find and read many different studies. Postgraduate training in Maharishi Ayurveda provides a unique educational opportunity for all of you who are eligible health professionals and who wish to expand the scope and effectiveness of your healthcare practice. It will also enable you to begin a new career or to supplement your existing career with the profound, time-tested natural wisdom of Ayurveda. During this training, you will learn how to apply the profound principles and practical skills of Maharishi Ayurveda in your current clinical practice, how to use that knowledge for the prevention, diagnosis, and treatment of common diseases, and how to cultivate optimum health. You will also learn personalized self-care programs, including transcendental meditation, which will help you to increase your learning abilities, job satisfaction, and general being in your own personal lives. The program consists of 6 courses and has 3 different teaching modalities: the on-campus block set, at-home blocks, and online webinars. The first modality is the on-campus block set, which will be held at the Alma Mater campus in Maribor, and where you will be presented with the core knowledge and skills of the program. Each block set consists of 2 courses, and we will have 3 on-campus block set lasting 8 or 9 days. We will have 8 hours of lectures and workshops per day, and just because of the coronavirus pandemic, the first on-campus blocks will be held online, and whenever the situation allows, we will schedule a residence section. The second modality are the at-home blocks, which are scheduled in between the on-residence block set. And at that time, you will be expected to put the knowledge and the skills learned during the on-campus block set into practice or your own. You should have 108 hours of individual clinical practice, and this will include the practice of Maharishi Ayurveda pulse diagnosis and the regular daily practice of transcendental meditation. Credits will be awarded for these activities, which you will be asked to record in a journal. This is a very important segment of your training because during this modality, you will enliven the theoretical knowledge which you gained at the on-campus block set. You will also be expected to go through certain recommended materials and the literature on your own. My suggestion and my heartfelt recommendation will be that you start applying this knowledge in your own lives as soon as possible and as much as you can. By integrating the essential Ayurvedic principles in your everyday life, you will bear witness to the powerful effects of Ayurveda within weeks. The highest level of support for your future implementation of Ayurveda will also come from the positive feedback you will start receiving from your patients as soon as you start implementing Ayurvedic knowledge in your daily medical practice. When your patients start following your recommendations regarding the daily routine and proper daily nutrition, which you will be able to give them after the first block set, you will start receiving their positive reactions within a month. We have had this experience confirmed many times with the former generations of our students. The third modality are the online webinars, and here you will have the opportunity to ask questions and share the experiences you had during the at-home blocks and from the practice with your patients. We will try to clarify anything that may be confusing or unclear and to answer your questions regarding the implementation of Ayurvedic knowledge into your daily medical practice. That means that you will have continuous supervision and support during the whole training process. The duration of the online webinars will be approximately 1 hour, and they will be held every 2 weeks. At the end of the course, you will have a final exam, which will take place at the Alma Mater University in Maribor in April 2022. Basically, this course is created for health professionals who already have medical knowledge and experience in working with patients, and you will receive the finest, most methodically systematized Ayurvedic knowledge, which you can immediately implement in your medical practice. This is one of the unique qualities of this course that differentiates it from all the other courses. Now let's look at the content of the training itself and the specific topics that will be covered. The topics are organized in such a way that you will cover all the important segments slowly and with ease, in such a sequence that with each next topic you will gain a deeper level of Ayurvedic knowledge, which will lead you to a wholesome understanding of Ayurveda and to feel secure and confident in your practice. The first block set, which we will organize online from the 13th of April to the 21st of April this year, consists of the first and the second course, which we will learn about the basic principles of prevention, diagnosis, and treatment in Maharishi Ayurveda. During these courses, we will learn about the role of the three basic Ayurvedic principles, about Vata, Pitta, and Kapha dosha in human physiology, about their function, location, and qualities, and about the effects of balanced and imbalanced state of dosha. For example, you will learn how Vata dosha is responsible for transformation, for movement and communication. It coordinates the locomotor system in our organism, also coordinates the circulation of blood, movement of lungs, peristalsis of the intestines, the activity of the nervous system, as well as the most subtle processes on the level of our genetic material. With this knowledge, you will be able to understand that the disbalance in Vata dosha may cause the development of many completely different illnesses. Our patient could come because he has problem with insomnia, but during the exam, you may find out that he also has problem with constipation and bloating. Women could also have problems with the irregular menstrual cycle, with spasms and heavy pain during these days. And after you take their pulse, you will see that all these problems have the same cause. It is the disbalance of Vata dosha. By treating this disbalance, you will simultaneously treat all the above mentioned negative effects and symptoms. And this is just one example. Also, a lot of neurological diseases, postpartum depression, many other illnesses could also be the consequence of these imbalances. And when you know the cause, it would be very easy to give recommendations about diet, about daily routine, about transcendental meditation at the very beginning of your training. Later in the course, you will be able to recommend the herbal treatments with MA products, with essential oils, specific Ayurvedic massage, and many other treatment modalities. During this course, we will also learn about chronobiology, about the daily routine and behavior, and how to best adjust our activities and our whole system to the biological cycles of nature. The next extremely important aspect which we will cover in this training is a personalized approach to diet, digestion, and nutrition. There is an old Indian proverb which says, when the diet is wrong, medicine is of no use. When the diet is correct, the medicine is of no need. My own personal experience shows that the change in the diet and the daily routine in accordance with Maharishi Ayurvedic principles can have amazing results very fast. From the cases in which my patients were not able to start taking the supplements right away, I had the opportunity to see how powerful the changes in diet can be. A good example of this are women who have heavy menstrual bleeding. By applying Ayurvedic therapy that includes changing their diet and their routine, especially during their bleeding days, they feel relief and see a big change in the first or second next menstrual cycle. The change in diet is also one of the main parts of the treatment of gastritis, colitis, eczema, frequent ear infections in little children, and so many other different health issues. Ayurvedic knowledge enables us to give individual diet recommendations to our patient based on the information from his pulse. These recommendations include when to eat, how to eat, in which environment to eat, as well as suggestion on which types of food to include and which to exclude from their diet. During the first block set, we will learn the steps of an Ayurvedic consultation. And the main part of this is Nadi Vigyan, pulse diagnosis, a practical, fully teachable diagnostic system that has been revived in Maharishi Ayurveda. We start to learn pulse diagnosis in this block, and we'll continue throughout the whole training. Each time we will go deeper into the practice, and with time, with a lot of practice, you will increase your ability to learn about your patient state. The pulse diagnosis is the basis and the essence of Maharishi Ayurveda, and allows us to get information about the physiological state of our patient within minutes. From the deep level of the pulse, we can learn about the constitution of our patient, about his or her prakriti. And from that level, we can get information about the weak points and the capacities in our patient's physiology. From the superficial level of the pulse, we could diagnose any imbalances present during the exam. We could find out about vikriti of our patient. We can also get other information from the pulse, and based on all that data, we will create a preventive treatment that will contribute to the improvement of the immune system, and a therapy that will initiate the self-healing mechanisms in the patient's organism, which very often removes existing ailments and imbalances. During the whole course, we will do self-reading of the pulse many times, and that will allow us to see the differences in the superficial pulse at different times of the day. And you will notice that the pulse is different before and after going to the toilet, when we are hungry and after the meal, before going to sleep and after waking up. But you will also see how having different conditions is noticeable in the pulse. I can say that for me as a doctor, learning about pulse diagnosis is one of the most important things I learned after finishing the medical university, and it expanded my horizons to what is possible when using Maharishi Ayurveda in conjunction with the Western medical knowledge. Sometimes a patient comes with problem in his stomach or with problems with constipation. But by using pulse diagnosis, you may find out that he has some unresolved emotional trauma or some other emotional problem, which is the real cause of the symptoms in the abdomen. In addition to the three doshas, we will teach you about the 15 sub-doshas, about their localization and functions in human physiology, and you will see how you will be able to notice these balances in specific parts of an organism by using the pulse diagnosis. For example, specific characteristics of Udana Vata and Bodhaka Kapha may indicate that there is a possible dysfunction of the thyroid gland, but I can give you many similar examples because the possibilities of the pulse diagnosis are simply fascinating. One of the most important aspects of Maharishi Ayurveda is the element of consciousness. And Ayurveda knew a few thousand years ago that many diseases, which are also present in contemporary society, are psychosomatic in nature, and that most of them may be effectively prevented and reversed by the proper application of evidence-based Ayurvedic modalities, such as transcendental meditation technique. This part of the course will provide information about the latest scientific research into the positive effects of transcendental meditation, and we have a lot of researches about that. It is very important for the doctors to have a daily transcendental meditation practice, because when the doctors do the pulse diagnosis from the level of the single unified field of pure consciousness, it enables them to be more perceptive of the imbalances which exist in the patient's physiology. The more regular your transcendental meditation practice is, the better you will be able to practice Maharishi Ayurveda with your patients. In addition to this, the regular practice of transcendental meditation will help you relieve the negative side effects of living in the modern, sometimes too noisy and hectic world full of stress. It is a simple but very powerful example of how by improving ourselves, we improve our medical practice. During the first block set, we will also cover other topics, such as the importance of Oja, Sagni, and Ama in our physiology. And we will learn how to give personalized treatment and diet plans to our patients for purification and rejuvenation of their physiology. At the end of this block set, we will start with clinical protocols. And during the first block set, we will cover digestive disorders, stress, anxiety, and depression, sleep disorders, and headaches. In Maharishi Ayurveda, it is important, very important, to understand the etiological factors behind the imbalances, and we will continually put emphasis on their importance throughout the course. The second block set will be held in Maribor in the first week of August. It will last 8 days and will consist of the third and the fourth courses. And during the first 4 days, we will continue to deepen our knowledge of pulse diagnosis, and we will continue with clinical protocols for common diseases. First, we will cover cardiovascular disorders, which include coronary heart disease, high blood pressure, and many, many others. Regarding these topics, I would like to share with you one of the most recent cases from my practice. I have a patient who has mitral valve prolapse and who started having frequent episodes of tachyarrhythmia. Because of that, at the beginning of 2020, his cardiologist suggested a surgical intervention. And we started with the Ayurvedic treatment, and he also practiced specific yogic breathing techniques in order to prepare himself for the surgical intervention. Because of the coronavirus situation, his intervention was postponed several times. However, at the checkup in January this year, his cardiologist said that he would not hurry up with the surgery, as the situation did not only not get worse, but it got much better. We will also cover musculoskeletal disorders, osteoarthritis, rheumatoid arthritis, back pain, sciatica. Next, we will learn about clinical protocols for the gynecological disorders, and it is one of my favorite topics. And you will see how interesting the Ayurvedic view is and how powerful Ayurvedic treatment could be. We will learn how to treat menstrual cramps, irregular cycles, premenstrual syndrome, hot flashes, urinary tract infections. I will also share my experience with you about the treatment of sterility. For example, I could show you the lab results from the woman who had FSH higher than 80 and LH higher than 50 and had a premature menopause at the age of 38, had not had menstrual cycle for 3 years. And today, after the Maharishi Ayurveda treatment, she is the mother of a 6-month-old baby boy. We will also go through clinical protocols for the respiratory disorders, common cold, pharyngitis, allergic rhinitis, sinusitis, cough, bronchitis, asthma, etc. And also through clinical protocols for the endocrine and metabolic disorders. My colleagues will give you lectures about some of these topics and share their very rich experiences. During the second 4 days of our second block set, the topic will be Dravya Guna, herbal medical treatments. We will learn about the most important herbs and the forms they may be used in: liquid, powder, paste, herbalized ghee, herbalized oils, tablets, etc. We will also learn about their taste or rasa, about the virya, the effects they have on our physiology, whether they have a cooling or heating effect, how they are used, how to determine the dose and the frequency of taking supplements, which will depend on the type of the constitution of your patient. You will have a vademecum containing the list of these supplements. And there you will also find a list of herbs they contain and the indications, contraindications, possible interactions, and methods of use. So you will be provided with all the necessary information that will allow you to safely and freely start to use these supplements. The last on-campus block set will be held at the beginning of December and will last 8 days. it consists of a 5th and the 6th courses. During the 5th course, we will learn about the use of essential oils, and this is a special and most fragrant part of Ayurveda, and also a very, very powerful treatment modality, which we use as a therapy for many different diseases. We will learn about the origin and range of aromatherapy, about the effects of essential oils, and the mechanisms of their action. We will also go through the indications for their applications, precautions, and the general guidelines for their use. You will see how we can improve our digestion with fennel or peppermint essential oils, or how we can use lavender for skin injuries and burns, for insect bites, and many other possible uses of essential oils. At the last part of our training, we will learn about the 7 dhatus, or the 7 tissues in Ayurveda, and you will understand the sequential progression of tissue metabolism. Also, you will learn how to prevent dhatu imbalances and understand the causes and risk factors, as well as the symptoms of dhatu imbalances. Last but not least, we will learn about shrotas, about channels in Ayurveda, and understand their physiological significance. You will also understand the various functions of shrotas as described in the classical texts of Ayurveda, and also understand how, by prevention of their blockage, we will preserve and improve our health. The knowledge of Maharishi Ayurveda enables us to understand how individually created purification treatment works on the level of the shrotas, and how it enables us to stay healthy. And you will see how significant this knowledge is. When I went through my first Maharishi Ayurveda training for health professionals, I remember I felt like I had a new eyes. It was like I got the opportunity to gain insight into the problems my patients came to me with, and to understand what is going on in their physiology on a more profound and deeper level. This enabled me to offer a much more complete treatment to my patients than when I practiced Western medicine only. I hope and expect that this training will have the same effect on you. And the essential support during the whole educational process in Maharishi Ayurveda is provided by the daily group practice of transcendental meditation. In spite of the fact that each training day lasts approximately 8 hours, with a lunch break and tea breaks, of course, at the end of the course, you will feel that you are much more blissful, joyful, and energetic than at the beginning of the course. This happens because this knowledge is extremely nourishing and brings us great intellectual pleasure. And I can say that Maharishi Ayurveda is the best thing that has happened to me in my professional life. When we feel the pulse, we know exactly what the person sitting across from us is like, what their potential is, and what their weak points are. So we see our patients and accept them just as they are. And this is the most beautiful part of this process. When the patients feel that they are seen in all their authenticity, the fear of how they are perceived by others goes away, and only then can they actually realize their full potential. So that moment is really transformational, and this is a special gift for all of us from Maharishi Mahesh Yogi and from Maharishi Ayurveda. I wish for all of you to experience the beauty of this knowledge and to enjoy your profession on a much deeper and more meaningful level. This training will serve as a very, very important step in that direction, and we are looking forward to supporting you on this journey. It was my pleasure to prepare this presentation for you today. And now, if you have any questions, we will be glad to answer them. And please make them concise, 1 sentence long. You can post them in the chat. Sylvia and Tomasz are also with us, and they can answer your questions regarding technical details about the university and the application process. Thank you very much.
Wonderful. Thank you, Dr. Marković. Please, we are eager to answer you. We will be happy to give you all information you need about the course. We have one question in the chat for Bernadette. How many days a week do you need to set aside as now work full-time?
Don't worry about this. You will read as you can, and you will practice self-reading many times of the day. And when you have a time during your regular job in regular medical institution, you will just take the pulse of your patient, and that will be enough. Really, don't worry. So you should be just relaxed, and knowledge will come.
Do we do patient studies in between blocks?
Yes. You will do this, and we will give all instruction about that when we start with the course. And we will show you how the best way how to take information about your patient. So you will do this. Thank you for nice comments. We can use this knowledge, of course, for children. I use this for my children, for my child, and for many little patients who regularly come to me.
The accommodation in Maribor will be available. The Alma Mater European does not have dormitories, but there are dormitories from University of Maribor. In August, they are free, mostly. So we will take care for it. But also there are a few nice hotels available on the very reasonable price in Maribor. We also had a group of Italian students of physiotherapy in Maribor, so we are used to having a lot of foreign students there.
About final exam, next question is about that. As I said, the final exam will be held at Alma Mater University in Maribor in April 2022. I think it will be on the 9th and the 10th of April. And we will have 2 days for the exam, and you will have a test, a case study, and a presentation of the topic of your choice, which we will agree upon in advance. It could be about daily routine, about diet, purification, treatment. We will see about that together. And I can say that the exam is usually very nice and enriching experience when you confirm once more how deep the knowledge which you gained on this training is. Thank you. Question regarding pandemic. I really hope that we will be in Maribor in August. We will see. Regarding situation, we will make a plan, but at the moment the plan is for all of us is to be there.
But maybe just to confirm, in case it's not possible to travel, we still do the second block also online. So it will happen, whatever happens.
Yes, we will not stop. Thank you, Dr. Reiner.
Could I ask a question? In case some countries might be allowed travel and other countries may not be allowed travel, you know, there may be restrictions on coming back. So will it be possible that if some people can go there, they can do that, and then other people, if they can't travel, will they still be able to do it online? Will you be able to do both?
We will see with each single each single person. We will see. I really would like if you can be in Maribor. It will be better for you. You know, for me it's okay, but I really think that it will be better for you.
Absolutely, so, I fully agree.
My suggestion, please come.
Yeah, no, we want to go. I'm just thinking
please
if we
come.
can't go, you know? But yeah, okay.
But I think in case legally someone is restricted to come, borders are closed, I think we still do the online teaching. And others are there, so I think it could be combined. We can probably technically manage that.
Okay, thanks, Ron.
Technically, it will not be a problem concerning the technology. I mean, we will just have to adjust the curriculum of that course there, that we have some students present and some online. It was like that also now in this study year, because we have exchange of students. Some have been from home listening to the online course, some have been on the campus. So technologically we are able to do both, but we'll see. There was one question from Megan. Must you already be a practicing doctor to complete the course?
As I said, basically this training was created for the health professionals, but you can practice integrative medicine methods depending of legal regulation in your country. For example, in my country, only medical and dental doctors can get license for these methods. But I know that it is different in some other countries, so of course you can apply. We will look at every single application and respond very soon. And I believe we will find the best possible way to support you.
Yeah, maybe I can add, you should be able to practice Ayurveda at home. You know, there are other professions than medical doctors that in some countries are allowed to diagnose and treat. And so if you are able to do that, even when you're not a medical doctor, that will be fine.
The next question was from Karma. If it is not possible to do it in this year, the course, is it on next year? Yes, of course, we are planning to have the course each year, but of course it depends on the group, on the cohort of the students. So there is one restriction. Of course, enough students have to be enrolled to start the course in each year. So we would like to encourage you to do it in this year if it is possible. The deadline for the application is, Sylvia, can you remind me?
Yes, the new deadline is March 31st. The course starts on April 13th, so until March 31st would be nice if you could apply by then. And if you need the address where to apply, I can put them in the chat message. There is a link to the Alma Mater website to a particular page. And let me just put this up here, where the enrollment forms are. So that address that you see now, that's where you can get directly to the enrollment forms.
And then you send it to me or to Sylvia with the documents that are enlisted on the page.
Yes, the instructions are on the enrollment form. And if you have any questions at any time, please feel free to contact me at professional.training@imavf.org.
So the next steps, what there will be. We have already many applications. All the applications will go to the session of Committee for Student Affairs for this course. We have some pre-requirements to enter the course, and the applicants will get the answer in like 10 days, 2 weeks, that they are accepted on the course. And then the course participants will get the contract from Alma Mater. There you can choose if you pay in installments or in one sum, and that's about it. then you're enrolled. And to mention, you will earn 30 ECTS credit points on master level from Alma Mater. This is also a part of master study at Alma Mater, which is called Health Sciences. If you wish, you can enroll regularly to this master, accredited master study in October this year. So you still will have to study a year and a half to get your master diploma after that.
We have one more question. A question about how much time daily takes this study. 8 hours during on-campus block set, but as I said, we will have lunch break and tea breaks, and during the at-home blocks you can arrange regarding to your opportunity, but during block set, online block set, and at campus, 8 hours every day.
Well, the calculation in European academic surrounding is like that. One ECTS is between 25 and 30 hours of work of the student. So if our course have 30 ECTS, then it is 900 hours of student work. And in that matter, our course was planned. In 1 year, you will have to find like 900 hours to accomplish all the tasks and learn the content of the course. But of course, one student is can do it more quick. Other have to do it like in additional hours. So it's average.
After each block in previous generation, when we finished, nobody want to go home, believe me. So don't worry, you will want to learn more. So don't worry about the hours.
Yeah.
Can I just make a slight observation that may help people who are thinking about it? I run the Ayurveda Centre in Ireland. We have 3 doctors here, Dr. Don Brennan and 2 Indian Vaidya's working here. And there has been an absolute explosion in interest in Ayurveda in the last 6 months. I mean, just an incredible explosion. We've had 12,000 people sign up for our online courses, just introduction to Ayurveda. So I think anybody thinking of doing this, there's a very, very bright future for Ayurveda in Europe. So I thought I'd just add that in case anyone was wondering would they get work out of this, because from our experience in Ireland, it's just been absolutely fantastic, you know.
Thank you, Noel. Already a TM practitioner, you will not have to learn the TM course again, of course. The plan is that between the first and the second block, you will attend the Transcendental Meditation course, which is standardized in the world, and there you will learn this unique technique. And who is already the practitioner, of course, it's not necessary to attend the lessons. The lessons, the TM course will not be part of the Alma Mater course in Ayurveda, but you will, because Transcendental Meditation can be learned everywhere, practically, then you will learn it where you live, between first and the second block. In Slovenia, we already had Maharishi Ayurveda courses, but not on the academic level. So we are very honored, very happy to organize this profound knowledge at Alma Mater Europea. It's the institution is 12 years old. We have most students in health professions, in nursing, in physiotherapy, also social gerontology. And we have like 20 courses from first to bachelor to master and PhD level degrees. So we are happy to welcome you to Ayurveda course at Alma Mater Europea with our faculty, Dr. Marković, Dr. Gordana Marković, and Emeritus Subhash Renade, and also other Vaidyas. We are sure that this course will give you this profound knowledge for yourself and for your profession. Allow me to thank you for your presence here, and hope to see you in April at the course 1.
Thank you.
Best regards. Good evening to all.